Do you or anyone else in your home have the flu? There is no cure, but you can reduce your symptoms naturally. Try these out right now. 1. Remain at home and get lots of sleep. Be considerate when you have the flu. Call your workplace or school the moment you see symptoms and let them know you won't be there for a few days. You're ill and extremely contagious. Utilize downtime and give your body the rest it requires. While your body fights the illness, curl up on the couch and read a book, watch a DVD, or just take a cat nap. 2. Hydrate yourself well. Ensure that you consume more liquids. Fruit juices, sports drinks, and other liquids can be consumed in addition to water. Also count our broth-based soups, such as chicken noodle soup. They aid in converting that unpleasant, thick mucus into a thin liquid that may be coughed up and spit out while also keeping your respiratory system hydrated. That's good because it could cause an infection if it accumulates in your lungs. 3. Treat fever and pain. Have a fever. That's as a result of your body raising the temperature to ward off the flu virus. If you feel uncomfortable or experience any of the associated aches, you might wish to seek treatment. With over-the-counter drugs such naproxen, ibuprofen, or acetaminophen. Which is best for you? Ask your doctor. Never administer aspirin to anyone under the age of 19. It is associated with Ray's syndrome, a dangerous disorder that can harm the liver and brain. 4. Attend to your cough. Treatments available over the counter can ease your hack. Consider taking an expectorant, which helps you cough up liquid mucus. Give children under the age of 4 no over-the-counter medications for colds or coughs. 5. Take a seat in a hot bathroom. Sit in the restroom with the door closed if you're still feeling congested. The shower should be run hot till. If you feel uncomfortable or experience any of the associated aches, you might wish to seek treatment. With over-the-counter drugs such naproxen, ibuprofen, or acetaminophen. Which is best for you? Ask your doctor. Steam that is damp floods the space. To prevent burns, sit away from the water. 6. Start the humidifier. A mist humidifier or vaporizer can moisten dry indoor air to help with coughing and congestion. Use a cool mist instead since heated mists can encourage the growth of mold and germs. In order to prevent the growth of mold, be sure to maintain the equipment clean. Try taking a lozenge. A irritated throat will become moistened and coated by sucking on soothing lozenges. It might also stop your coughing. 8. Become sour. There are over-the-counter saline nasal sprays and drops at every drug or supermarket store. Even for children, they function and are secure. Fill one nostril with a few drops, and then gently blow the mucus and saline out. Once both sides are unblocked, repeat the procedure on the opposite side. 9. Request an antiviral drug. These medications are used as soon as symptoms appear. They can shorten and make the flu milder. If you develop symptoms of the flu and are more likely to experience problems, call your doctor right once. That covers everybody under the age of 2 as well as those over the age of 65. It also covers people who suffer from certain chronic illnesses, such as those that affect the heart, kidneys, liver, lungs, or immune system. Native Alaskans and Americans are also more susceptible to problems. The CDC suggests zanamivir, peramivir, rapivab, oseltamivir, Tamiflu, baloxavir marboxil, Xofluza, or Relenza. When used within 48 hours of the onset of your initial symptoms, the medications perform best. If you start taking the medication right away, they might reduce the length of your illness and make your symptoms less. Some medications must be taken for 5 days, while the more recent baloxavir marboxil, Xofluza, only requires 1 dose. In those who have been exposed, oseltamivir, Tamiflu, or zanamivir, Relenza, can also aid in the prevention of the flu. Call your physician if you have any of the following signs as well. Experiencing an earache or ear leakage. More than a week of thick yellow or green mucus and facial or forehead pain. A temperature of at least 100.4 F. In a baby under 3 months old. Greater than 102 degrees Fahrenheit temperatures in adults or older children. A persistent cough, sore throat, or hoarseness. Wheezing. Breathing difficulty. Vomiting. The presence of symptoms that worsen or persist. In a baby younger than 3 months. Older children or adults who have a temperature of more over 102 degrees Fahrenheit. Hoarseness, a painful throat, or a persistent cough. Wheezing. Respiration difficulty. Vomiting. A worsening or persistent symptom. For immediate assistance, dial 911 if you experience difficulty breathing or increased shortness of breath, chest discomfort, confusion, seizure, fainting, extremely fussy infant behavior, or trouble waking up. Please don't bother requesting antibiotics. They exclusively function against bacterial illnesses. A viral infection, the flu.